All right, who wants to start off? Anybody want to shoot the shit? I guess. Okay, I like it. That's
I
easy.
sent a DM to Zach Couples
Yeah.
regarding the split squats,
Okay.
and so I was like the last time we left it off on the split squat, it was like going down,
Yeah.
going you know 1 foot forward, left foot back kind of thing,
Hmm.
and uh whatever. Like at the end, I think it was like going down on the left leg on the leg that's at the front. To me, it made sense that it's like the sacrum is going back kind of thing.
Hmm.
Anyways, like Zach kind of like mentioned in the same thing as you were saying in terms of
Hmm.
like explanation. Um, but then I was just like I was trying to like get the point across with the back leg, and
Hmm.
I was like, because he was like, you're going in a deeper hip flexion, so you got to look at the sacrum, so it's going backwards on that front leg. So I
Hmm.
was like, okay, what's happening at the back leg in terms of a gait cycle?
Yeah.
And I ended up looking at that thing that I sent you was like a video from Bill kind of talking about it with one guy, just kind of
Yeah.
like a 15-minute consultation.
Hmm.
And it seemed like even like Bill was taking the front leg, the sacrum was going back. So it's like technically going towards like
Towards heel
backwards,
strike.
ER or
Towards.
heel strike, all that.
Yeah.
So then the back leg that's like 0 degrees at the end would be probably 0 degrees still. Is that on a split squat? You would still call it a 0 degree thing?
Like at the back, right? Like, sorry, at the
The
bottom.
back leg. The back at the bottom. Yeah, the
The
back leg
bottom.
at the bottom.
Yes. So
Yeah.
okay, so think about it this way. Let's say I'm starting in a normal split squat, just normal, like nothing. I don't have front foot elevated, anything. It's just normal split squat. The front leg, because it's flexed, the sacrum's going to turn towards it. So realistically, we're going to be starting in an earlier, like mid stance ish, whereas the back one's going to be in more of this late mid stance. Okay.
Yeah. So like
Or
what
toe
true
off and heels, like, yeah, it's mid stance. It's late
yeah,
IR and early IR. Okay. As I
yeah.
go down, everything goes backwards, right? I'm going back towards my heel on that. But then as I come up, because as I'm coming up, if I continue to go up, I'm going to move forward. That leg's going to swing across. Does that make sense? Like when I'm going like this. Okay.
The main thing was the back leg.
Yeah. Okay. So let's focus on the back leg. I'm in this position here. Okay. So let's say this is like, let's say this is mid stance. This is like late mid stance. Okay. So when I go down, right, it looks like I'm going like this, right? But I'm not. I'm keeping my met heads in contact with the ground as I go down, which is going to limit how far I go down. So in this case here, as I go down, because the sacrum is going to be turning this way like this back leg is still going to go backwards. It has to, because everything kind of shifts back. So this stays in late IR. This goes back into early towards heel strike. Okay.
That's what I wanted to clarify, essentially that back leg, because I feel like if one is gonna go into early IR, like I feel like the other part of the sacrum on the right side, the back leg, would like slightly go forward. You know what I mean? Like that
Yeah.
that is the question that's stumping me in terms of like understanding
Okay.
what would happen as we go downwards within the sacrum, essentially. Because if the sacrum already is pointing towards the left side, if you stay in that position, right?
Would be like
It's already pointing on the left side, right?
starting here and sorry, starting there and then there, right? Like just slight.
Yeah. And then as you go down, I'm assuming the sacrum is gonna go further into that same direction.
Yes and no. So I'll tell you why. Okay. So when I'm going down and when I'm in this position here, right, as I go down, as you said, this is going to start to go more forward. The thing is if you are cueing, hold on to the mat heads here, this is not actually going that much more forward. Does that make sense? You're kind of staying into this position and maybe you're getting a little bit more femoral IR. The sacrum isn't turning back more, if that makes sense. It's just more the femur's motion. Okay,
Okay.
like if this, in order for this right hip to go forward, the innominate has to push the sacrum forward, like so, and turn to the other side, which means this sacrum has to turn more and more towards that side. That makes sense?
In this scenario, is the ilium kind of like going backwards as well, or is it going forward as the sacrum is going backwards?
It's gonna go, the sacrum will go forward as the innominate goes backwards. Okay? If I'm in toe off, if I go toe off, what happens is the innominate acts on the sacrum and pushes that sacrum forward. Okay? In this case here, the innominate will stay stationary as the sacrum turns on it. That's heel strike. The innominate doesn't move, it's just the sacrum turning on it. Okay?
This is is this when the left foot is forward?
I'm not talking about split squat. I'm just talking about
Oh.
normal mechanics just to start.
Oh, okay. So
Okay.
heel strike, ilium stays the same, sacrum goes towards, glides on it backwards.
Yeah. Think of the femur motion as the transition movements. Okay. So when I go into late IR. Okay. Late IR is going to be nutation, right? So it's like I've got early IR. That is femur internal rotation. I can't IR the femur anymore. So now what I got to do is I got to shift the pelvis forward, and I'm going to do so by expanding and nutating the sacrum. Okay. Right. And the nutation of the sacrum comes because I'm here and then I'm shifting forward slightly. So I'm going to get more nutation on the side that I'm extending my hip, which in this case would be the right side. Okay. I've got early IR. There's the femur internally rotating. I can't internally rotate the femur anymore. So now the pelvis moves over top of the femur. Okay. I've got a femur moving on a sacrum. Then once I get to late IR, I go hip extension. Now the pelvis moves over top of this femur that is internally rotated. Okay. Does that make sense?
Maybe it'll make sense if you place an exercise on top of like the explanation. That would happen like with a.
Okay, so if I with a front foot elevated split squat, okay, with a front foot elevated split squat, I am going to be getting more femur internal rotation on this side. Okay. On the on the left leg, the left leg that's forward, I'm going to be getting more femoral internal rotation. But because I stand on here, it makes sense that really my weight's kind of like this, right? Where my weight starts more in the right heel. Okay, so think of this as I'm starting in early IR here. I'm starting in heel strike on the left. Okay.
Okay.
Then I come up onto my heel. All right. Well, now this hip is slightly more hip extended. Now I'm starting in early IR. Okay.
Okay.
As I go down, I'm not losing my mat heads, but now I'm extending this hip. So now I get more nutation and I'm getting more femoral internal rotation. Okay. Does that make sense?
You're getting more nutation on the right and more femoral internal rotation on the left. Is that what you're telling me? Okay.
Yes. Okay. So that's what's happening. As I come up, it's more of this ascension overcoming. And so what happens is that would shoot me forward if I continue to go. Okay. I would go like this and then that. That's what's going to happen. as I come up, now this right hip becomes toe off, the left hip becomes later IR mid stance. You think this is what's happening. That's what you think is happening. That's not what's happening. A split squat is more of a horizontal movement, a forward propulsion. It'll be like that. Okay? So to start, I'm starting in femoral internal rotation on the right. More of a heel strike position on the left. As I go down, the sacrum turns. How does the sacrum turn? Well, I need my femur to be able to internally rotate, otherwise I'm going to roll on the other side of my foot. Okay? So if I'm trying to turn a pelvis to the left, while getting internal rotation on the left, I'm going to do a front elevated split squat. Because the front foot elevated is going to prevent how far forward I go into the gate side. If I am here, my foot off the ground, I'm going late, mid. Okay? So as I go down, I go early mid stance towards late mid stance on the right. As I come up, it's toe off, late mid stance on the left.
So where does it fit in where we were talking about it? I feel like last time going down, being like ER, kind of going backwards, coming back, being IR, going forwards, and kind of I was assuming we land at the same spot from where we started.
Depends on the weight.
Depends
Right.
on the weight.
Depends on, okay, like let's say I give you, 20 pounds hold on each side.
I'll go forward. I mean, depends where I'm holding it. It's not Zercher, it's next to my body waist.
Next to your body.
It will make me heavier, it will make me go forward.
Yes.
Okay.
Okay. If whatever arm I'm holding the dumbbell, I'm going forward on that side.
Yes.
So let's just say you have somebody who's quite stiff and you're like, look, I need to improve femur internal rotation on the left side. Okay. The reason why I would give them a contralateral hold. So I would left foot forward, right foot back, right hand hold. Okay. Left foot forward, right foot back, just like we're talking about. The reason why we use the dumbbell, because as they go down, right, and I bring the dumbbell across, that's going to further turn me into that left hip. And that's going to like bash through the concentric muscle tissue in the posterior capsule. If I got you to do it yourself, you may not be able to do that. You have to yield yourself and you can't put those muscles in an eccentric position. It's too hard for you. It's too difficult. I need this external load to be able to do it. The weight is just going to force the position that is already supposed to happen. Okay.
Same thing would happen if I did a lateral lunge with a Zercher on the left and a right right hand holding down, weight down at my waist area in the middle section of my body, kind of thing, like that, like that.
Exactly.
So you're just bashing through the concentric tissue in the side of on the left side that is like not allowing you to nutate or have internal rotation at left hip.
Exactly. Like what's the dumbbell doing? It's pulling you down to the ground, right? When we go into hip extension, what is our intention? To push the pelvis forward and face the socket downwards, right? Because when I go hip extension, it is this. So the socket's now facing down as the pelvis goes forward. So the dumbbell, as you go down, is going to pull you forward and face the socket down. You're just over exaggerating this thing. I can't get the hip extension myself. So I'm going to give you dumbbell in your right hand. And then you can't get femur internal rotation on the left. Well, what does the band do? The cable do? It pulls you
forward, not down, but forward. So you got to pull yourself back against it. So you're using those things to create the exercise. But the reason why I'm saying as you go down, the front leg is going backwards. Okay. Is because as you go down, things have to yield. Right.
Makes sense to me on the front leg.
But the back leg
is confusing because if this is the sacrum and I'm going left, I feel like, yeah,
okay.
I'm going back on the left, but I'm going forward on the right kind of thing.
Okay.
And when I go back in place, I go back in position.
Okay.
That's kind of confusing for me.
Unless you have the heels elevated on the left, the sacrum is not turning in a split squat. Okay.
To start with, or
just when you're going down in a split squat, if you don't have a heels elevated position, don't worry about the sacrum. The sacrum's kind of where it is. You're focusing more on the femur's motion. Okay. When I'm doing a front foot elevated split squat, my main intention is not to turn the sacrum and get yielding back there as if somebody has an SI joint issue. I'm thinking about how do I get yielding down here from the sit bone to the greater trochanter. Okay.
So we're thinking more femoral internal rotation.
Internal rotation. Whenever the leg is back, you got to think it's this space between the sit bone and the ischium. Always. Okay.
The leg is back or forward?
The leg is back. That's what.
Oh, okay. Yeah.
That's what we're going after. So if I've got somebody who I'm trying to turn from right to left, right? Let's say they've got 10 degrees or positive 10. Remember 0 and then negative. Negative is good. Positive is limited. So if I've got a positive hip extension, maybe around 10, I'm okay to put somebody in this, hip extended position. But I want to cue the met heads, because if I cue the met head on the back leg, I stay within that phase of gait. I don't go forward. I'm locking myself into late IR.
I was going to say holds on to late IR.
Holds on to late IR.
Like I say, I think the last call, right? I talked about just take a look at the rib cage if we're turning, right? It's not that we're doing. If you're looking at top down here, it's not this. It's that.
Yes. Yeah. Right, Ivan? Like if I hold on to the met heads, if I let go of the met heads, I'm going to go towards my toes. I will go towards toe off in that case.
I kind of understand that you're saying a split squat is narrow, hip stance. It's more in an IR kind of position. Yeah. Therefore, there's not going to be a lot of movement.
No.
Like
that's why the sacrum doesn't move much.
Yeah. Should I think about more femoral IR and sacral rotation as opposed to gait cycle then? Or, I mean, I know they should fit together, but I feel like with this gait cycle, it's like, I don't know why I can't wrap my head around it or something. Because like, if from last session, I feel like we've talked about it. From my understanding, it was like, let's look at the split squat with the right foot forward on an elevated surface. We kind of mentioned that, I mean, it's early kind of mid stance area, right? And then you go down, like in that scenario, right? I think last time we talked about it, going down is we're ERing.
Bias.
ERing bias.
Not actually ER. And when we say ER bias, just to clarify,
ER bias, we're still, yeah, we're going backwards. We're still within the IR.
Yes.
Except we're ERing within the IR, let's call it.
Which just means
going
that
backwards.
It just means we're going backwards, but we're focusing on the femur's motion.
So I'm thinking like we are in early IR, and we are, because there's no huge movement in the sacrum, technically we're not getting to heel strike. Is that correct?
Yes.
Okay, so we're kind of going backwards from early ER. We're just going backwards, but we never really get to heel strike.
No.
And then on the way up, I think last time the way that I was thinking about it, I just kind of go back to where I'm at on the front leg, or am I finishing somewhere else if we have no weights involved?
You'd go back to where you normally are.
Okay. And in the scenario of the opposite leg, where in the same scenario, right? So we have the left foot forward on an elevated surface, and we have the right leg backwards. Let's call it within zero extension or whatever. And we're sinking down. Down one, I mean, I know I'm in IR, right? A little bit later IR than the opposite leg, obviously, right?
Yeah.
And I'm sinking down. What's happening when I'm sinking down in that scenario? And when I'm coming up, we have no weights, and when I'm coming up, am I still going back to where I started from?
No. When you put a front foot elevated, what you've done is you've shifted yourself back more, right? Like put my left foot on the box, okay? Then it makes sense that my right foot has more weight on it, right? Just to
Yes.
start. Okay. So in that case, I've shifted my center of gravity back, which means I now have a horizontal force vector versus a split squat with no weight, just going up and down. Okay. I've now shifted myself back, which means I need to come up out of it like an airplane. That's what's just going to happen because you've changed the angle of force. Okay.
So are you saying on the way up, I got to come up as an airplane forward?
Yes. That's how you're coming up. And the same thing with a rear foot elevated split squat. You have now pushed your body forward. So remember, we've got the negative horizontal going towards heel strike. We've got the vertical, which is mid stance, right? And then like early mid stance type thing. Late mid stance and toe off is more of this positive horizontal, right?
Yeah. Yep.
And so therefore, if I do a rear foot elevated, I'm dumping my body forward. So now try doing a rear foot elevated split squat, staying straight up. You'll see a lot of people try to do that when they orient their pelvis. But really what you should be doing is having a little bit of a forward lean because the line of force is like that. Whereas the front foot elevated, the line of force is more decline, back and down. Okay.
Okay, but in a scenario where it's the front foot elevated, and we're saying that it's an early mid stance on the left foot, and we're going down backwards on that left side, and we're coming back to its normal position. But then if you look at the other leg, the back leg, we're saying we're going down. As we're going down on the back leg, are we going
Yes.
backwards?
Yes. Because
Okay.
we're going down on a decline, right? It's like we're walking downhill. And so if I'm going down.
No, this is elevated, foot elevated at the front, not
front foot
rear.
elevated.
Front foot elevated?
Yeah.
Wouldn't that give you that kind of?
But what's going to happen, right, is as I go down, I'm going to naturally put a little bit more weight onto that left foot, right?
The elevated foot.
The elevated foot.
Okay.
Okay. Which means that, let's say when I started the movement, okay, let's say that when I'm here, I'm 80, 20. Okay. Then as I go down, maybe I'm 60, 40. Okay. Let's just arbitrary numbers, but I mean, you can feel it. I can feel my left leg working more than my right leg. Whereas back here, I can feel a little pressure on my right leg. So in this case here, if I've effectively unweighted this right side and loaded this, and I've got more force in the ground here, which means I'm earlier IR, femur motion. So yes, I'm turning back on this side because I'm flexed, but because this side became unweighted and lighter, it makes sense to kind of gone back a little bit, right? But then as I come up and go forward, now I'm losing weight on this side, and I'm loading my toes, and if I keep on going, it's gonna be like this. Okay? So as I go down, more weight should shift onto the front foot, which would unweight the back foot.
Okay. And then on the way up, on the back leg, my question was like, if we're saying, if we're saying that we are not finishing to the original position on the way up, once we finish the thing, if we're not in the same position on that right leg, on the extension leg, like we're further forward, I'm guessing, right?
Mhm.
Then technically we cannot say that the left leg is back to the original position. Something has to change on that left leg.
Not with the front foot elevated. It will now start slightly ahead of where you started from.
Okay, so it's not its original position.
No.
It's slightly, you said slightly more forward. Is that what you said?
Yes. Yeah, because you've
Oh.
propelled now. Now the tissues have become more concentric and overcoming, so you've had to push that body forward. Otherwise, gravity would win. You wouldn't be able to get up. Think about it. In order to get up out of a split squat, you have to produce, let's say gravity is 1 pound, you have to produce 2 pounds of force to be able to get up. Which effectively, if that's the case, you've got more muscle tension, so you've got to push yourself forward more.
So to me, it's like a split squat is gonna give me internal rotation, right?
Yes. Yes.
But would I want to choose if this thing is gonna like push me forward on both sides at the very end of a split squat?
But that's
It's
why, yes, exactly. But that's why you got to have a Zercher, because you're like, hey, even if I'm pushing myself forward, this thing is catching me and shoving me back on that side. Now I'm directing where I want that expansion to happen. The rib cage is easier to visualize, but I've got the Zercher and I'm like, okay, well, I know as I come up, this right side is going to shoot forward. So I don't want my left side to shoot forward too. So I got to catch it with the Zercher. Right?
Or you can stop short, like if you're doing like a lunge. I know, like whenever I do
Yeah.
my reverse lunges, it feels way better. I have to stop my back leg coming forward. I almost have to go on my toe, but it's like this.
Yeah.
My left
Yeah.
leg's forward,
Yeah.
right, and I have to lunge back like that. And up here, I can't. Whereas, like if I look at like my super mobile golfers and stuff, they can come right back up and put their foot right to the side. Or I actually did this. I went over a park that has a big ramp, and I warm up there, and I did some lunges. I was able to bring my foot back forward, but it was downhill because I had more space to stay back.
Yeah. Like think about it this way. If I were to say, okay, Ivan, what I want you to do is so there's two things before I say that. What Ryan mentioned is really accurate. And a lot of people will ask me is like, how do you hold on to the med heads during a split squat? And what do a lot of people do to teach somebody how to split squat? They reduce the depth. So maybe you stack up AirX pads to the back knee so it limits how deep they go into the split squat, right? Like if I want to focus on femoral internal rotation only, right? The normal split squat, like maybe it's like a small oscillation, right? I'm not going all the way down here, but I've got pads there where I'm just kind of touching. That allows me to keep this med head engaged, right?
Shift it into that's where you shift into like your dead leg, your split deadlift variations, right?
Exactly.
That's going to be a sharper turn into that side.
It's a sharper turn. This is wide turn, which is why there's no sacral motion. But when you have a sharper turn, that's all sacrum, right? We're thinking about what's happening outside the pelvis right now. We're thinking about the innominate and the femur. Whereas when we start doing staggered stance things or heels elevated stuff like heels elevated lunge, now I'm focusing on what's happening between the SI joint, right? It's like, why do people have SI joint issues? There's got to be some yielding issue around the SI joint. Like the innominate is probably moving too much on the sacrum. Do you know what I mean? Or I have a sacral position that is, the innominate's pushing on the sacrum, But then I've got my upper body shoving me forward more. So now it orients more, puts more pressure on the sacrum. And then you start jamming into, you have, joints jamming into each other for stability, right?
My next patient is SI joint on the left.
There you go. It's all the same shit though. Like I don't worry about like where the pain is. Focus on they can't yield at the SI joint, but you have to identify like where is their pelvis in space. And then you may have to do manual stuff with them because again, like I said, like hey, you get in the Zercher and the split squat and you're doing that to bash open some tissues and the rib cage and the shape. But it's like that sometimes is hard. Like you give that to me, I struggle with it, right? Like naturally, I struggle with it. I have so much like I have tension in like the posterior capsule and stuff like that, where you may have to help them expand the area and then teach them how to yield themselves.
Yeah, I did because I also have a massage therapy license. So I was doing some massage on him for like, I don't know, like a couple of sessions in a row, and his pain went away, right? So I was like,
Yeah.
okay, now you come and see me for Cairo. We're gonna do some rehab. Let's integrate it. So the first session, I think I just gave him like a foam roller, like laying around on the foam roller just to like get some more looseness in the pelvis. And then the last thing I had him do like a cross connect, which I find that he didn't really do because like I guess standing on the ground. So I instead gave him a chop. And I don't know, like he says that he's doing the chop, but he's also saying that slowly the pain is coming back. So whatever he's doing, he might not be doing enough, or I might not have given him the right strategy, or
Is he wide or narrow?
I would say narrow. Like I can't remember exactly, but I like he's not like a narrow like a
No,
like
narrow
the people that
person.
are like super narrow, you know what I mean?
Narrow. No,
When
but
he
like,
lays down, he's got that diaphragmatic like low diaphragm sitting like
yeah.
popped up rib cage kind of thing.
So it
But I would say it's more narrow.
could be narrow. So okay, so in that case there, you have to consider, right? Like, is it if you're doing a chop, for example, okay, what is a chop doing? Is a chop affecting the sacrum movement or is it affecting the femur motion?
So I'm doing left. So his pain is in the left. I'm doing left side back, chop into the left pocket.
Okay, so then it
I
would
think
be
I think I'm elevating his heel. I gotta look at my notes, but I think
hey, then you would be influencing.
and it's head on. The chop is head on.
Okay, then you're influencing the sacrum in that case, right? Because your stagger stance, you got the weight on the back foot, and then you add the element of heels elevation plus the element of the cables in front of me, right? So now I'm focusing on stuff inside here. Okay. If I have pain doing that, what does that tell you? If I have pain when you're trying to
Probably orienting.
exactly. Because and is this the issue here? Or is this the issue? Right? Okay. Let's break it down. If I'm doing right foot back, left foot, sorry, left foot back, right foot forward. Okay. I'm like this. It's not really like that. Okay. And I'm doing a cable chop. What the motion of the cable chop is going to do is this. Okay. I mean, pretend like the pelvis isn't orienting because it is pretty rigid, it doesn't move very well. But you need to catch that momentum. So this needs to IR for this to ER. Does that make sense? This has to IR for the sacrum to turn onto itself. Otherwise, I'm going to be supinating that foot and kind of rolling on the outside of the foot. Does that make sense?
I was expecting the sacrum to nutate in that scenario.
Which side?
Left side. I'm expecting it to counter nutate. Like, what is the biasing in that scenario on the chop on the left leg back?
It's going to be, you're going to be turning the sacrum. It's not going to be, it's not going to be nutating. It's going to be like, so here's the thing. It's actually counter nutating, right? People think that this is nutation. It's not, right?
Because I'm looking at the gap there getting bigger. That's kind of what I'm thinking.
Well, you don't want the lower back to arch, right?
Yes, no,
Okay.
we don't want that.
So, right. So what we're doing is we're keeping the sacrum fixed. We're just moving the ischium away from it. See what I'm saying? That's what's happening. I'm not doing this. I've got my sacrum fixed. This side is nutating to go forward. See what I'm saying? So it's actually, it's the ischium moving away from that side. Okay. But
You said it's counter nutating.
it's counter nutating.
Yeah.
Relative, you know, it's not like full, like,
I've been trying to watch the counter nutation between heel and strike and toe off. It's really tricky. It's a lot trickier than it seems because it's two different. It's relative motion. It's really easy to forget the relative motion.
It is.
And, yeah.
It's like the reason why toe off is still some degree of nutation is because the back is arching at that point. Okay. So it's like shoving everything forward. So it gets that fake nutation, right? I mean, it's still kind of counter nutating when we resupinate because sacral tuberous ligament, the Achilles, all that stuff has to contract and that counter nutates and turns everything the other way. But what we're looking at here is not a heel strike, is not a nutated sacrum, right? It's not.
So what was your point there, Alex? You were saying that
Okay, so my point,
when somebody's doing a chop and there's pain on with the chop, are we going for sacral? Are we going for femoral? Is that was kind of the question you were proposing, or
why? Yeah, which one do they not have?
It's actually ischial, isn't it?
What's that?
So if you take the foot and you fix the foot into the ground and you put the left foot behind the right foot, you're technically stepping backwards. So you're swinging through a little bit, but because the foot is on the ground, and even if you, like I've seen that move done a lot where you put a block between the knees or something like that, which would further inflare the ilium, then what you're essentially trying to do is, because you're trying to move back towards heel strike, like I've heard you say, you want to use a movement like that to finish a turn. So you're fixing the sacrum, and you're actually biasing the ilium away from the sacrum. So you are getting like you're getting space between the sit bone and the sacrum, but you're doing it by means of the ilium as opposed to by means of the sacrum. So it's the distal versus the proximal structure that you're influencing. That's what that move does, right?
Exactly. You're getting this.
Right.
You're getting that. And so the problem is if he's feeling pain with it, he does not have enough femoral internal rotation to be
it's trying to yield too much at that.
Yes.
The SI. Yeah.
I can't, Ivan, I can't yield here. Right?
Yeah.
So
I get that part. Yeah.
I'm trying to orient and kind of roll back on that SI joint to get it. Right? I'm trying to get too much lumbar flexion rather than expanding here to be able to finish that rotation.
So this is someone that can't catch their medial heel.
Yeah, someone who's going the outside of the heel as you're turning, right? So it's like going here.
So that would make sense that he's a narrow then.
Yes. Yeah. So he's going like.
Because a wide wouldn't do that. Probably.
That's very over exaggerated. That's what he's doing.
Yeah, I kind of had to work on his form for sure. So in this scenario, are you saying like, because we previously we talked about a split squat, you're kind of aiming for that femoral space in the back. Is that something like a front foot elevated can clean that up a little bit? Would you
Yes.
say so, or is that too narrow for him? Or would you go lateral lunge maybe?
Depends on his measurements. Does he have 20 degrees of internal rotation of the femur?
I don't know. The
Hip
last thing I
extension.
checked was a straight leg raise, and I feel like it was really like it was bad. Like he's still bad even though he's laying down on the foam roller and whatnot. Like he's getting better. Like his pain is like significantly improved, but it was like a little bit of a backward kind of step last week kind of thing.
He's here.
So if you were to flip it, Alex, like
Yeah.
if you were to put the left leg forward and chop into that side, then that would influence. So that would be a better thing for him, right?
That would be better.
Now
Yeah.
you're moving him to that would be a late. So the left foot back is the earlier stance. So if you put left foot forward, that's a later stance. So now you're bringing him from late to mid earlier IR.
Exactly.
Yeah.
He's going to be better with that for sure.
Yeah.
Right.
You're
So-
kind of starting him at that counter nutated position forward, because if you put it on the back leg, that's just that's closing off the space he doesn't have. So you're just giving him more ER with the later
Exactly.
stance, and
You're extending his hip, right?
Yeah, and additionally, what if you were, so again, we got to think, can these people create the yielding themselves or not? And so how would we take that one step further? So we said the left foot's forward now. How would we take it one step further to, essentially unweight the foot and gain more IR through the femur? What could we do with the left foot?
How old is this guy?
He's like middle age, like maybe like 40, 35, 40.
Man, come on, I'm 40. Take that.
Yeah.
I'm actually 41. Damn it.
Like he's in,
Well,
like
could you
decent.
well, the other thing too is that the other thing to play around with the narrow, especially when you're trying to teach them to capture a medial heel, is the tempo, and it's like is how much time you get them to spend, and that. So like if you're looking at a chop, for example, and you have say you put him in a front foot elevated position, and his front foot is on a box. Like you could chop across your body and you could hold it there for like 5 to 10 seconds, and you could cue, like you could put your hand on his medial heel and you could say, find pressure here,
Yeah.
and then you could chop back up, and you could use that as a variable progression, like just as an example. But
Yeah. You can hold
that
it too, right? Like that's the
Yeah.
thing.
You can chop straight down too. If you can't do the turn, just chop in front of you with both hands as opposed to the back pocket.
It's almost like a tricep extension, right? You're kind of doing like a tricep extension on that position. What I was saying is maybe what you do, Ivan, is you do get the left foot in front, but not this high, of course, but like smaller, and then you do the chop here, right? And
you're just making that spot heavier, right? You're just aiming at that spot. That's great. Yeah.
Yeah, and as Ryan said, you're not coming down here, but maybe you're stopping just in front. Because as he comes here, he's going to try to do that, right? And so you're staying like this.
Yeah, that's good. So you lean it forward a little bit into that position.
Exactly. So you hold open the sacrum into nutation, right? And then you're using the momentum of the cable to put the force down the ground. And so it's like a top-down internal rotation. Because now he's doing too much in his feet and he can't get that rotation. Like, for example, if I were my left foot back, right foot forward, people always focus on the left foot. The most important part of it is the right foot. Am I able to pronate that right foot to turn into the left? Or what people will do is as they come back, they'll hyperextend the right knee as they come back.
Yeah, I was working on that with him quite a bit, and yeah, like just not to like cheat on the right knee essentially.
Yeah, and so you may have to hold his right knee.
Can you show that really quick? Hyperextend on which?
Yeah. So he'll do this.
Yeah, I'll go backward.
Oh,
Yeah.
Okay.
Yeah, because he doesn't have the
Shift
motion
every-
to move it.
He's gonna do that like if we said, if we just switch the left leg forward, like he's gonna do, he's not gonna want to hyperextend there, right?
You can't
Yeah.
do it, you can't do it.
So that kind of clears everything up right there, just switching the stance.
It does, it does. And you also see with lateral lunges, people go like that.
Mhm.
Kind of like
Yeah.
going sideways, like a golf swing, they'll kind of shift their hips laterally. Versus this kind of rotation into the hip, right? What people say is like, oh yeah, I feel like a huge groin stretch doing this lateral lunge. And that's just because they're shifting on the outside of their foot like that. They're keeping this leg into ER, just hyperextending the knee. Do you know what I mean? They're not actually like realistically, this knee should stay slightly bent.
Yeah.
And I should be turning into this left hip, right? Left back pocket.
Yeah, I've been recently cueing right like that on a lateral lunge to keep that knee slightly bent and stay in the tunnel. It like makes a huge difference for even for me.
Yeah.
I feel like with the cueing stuff, I gotta get better at that for sure. But that's one thing I picked up last month.
But picture this, Ivan, right? Like, think of his pelvis as ER'd. He gets pain doing so, like, your intention is to yield the sacrum, okay? But when you have somebody who is a narrow, like you're going to have the concentric orientation to the left. In order to actually yield the left side, you have to get the femoral internal rotation first. Okay. And so what you need to think about doing is before you get into the chop, maybe you go after what are the muscles that are going to prevent femur internal rotation, and what are the muscles that are going to jam the ischium towards the sacrum.
Performers, gemelli, those guys.
Sacrotuberous ligament, posterior glute med, lateral bicep, femoris, lateral hamstring, VL, TFL, like all those things are going to be holding on. Right? I mean, think of it this way. You ever see somebody when they do like a lateral like abduction, they kind of go like this? Okay. Why is that happening? The humerus and the socket are basically together with each other, right? Or like the clavicle, I should say. The clavicle and the humerus are being jammed up together like this. They're already starting at some abduction and they go up. So what do? You create space between the femur and the ischium, especially with the narrow, right? On the left side, what are they going to do? They're going to ER, they're going to go forward. So this space is kind of coming together like that, right? Okay. And so you may have to look at those things. It's like, use a Faber test, like the FAIR test, right? And then the FAER test, you'll see if the TFL is kicking on or not. Do sideline hip abduction, like all the stuff that you probably learned about at one point in your chiro school, right? Do those little tests, be like, hey, let me get specific. Is the TFL hot right now? Yeah, okay. Well, I need to release that. I need to release the glute anterior glute med, VL.
So what would be like a nice progression? Like, let's say we rub on that and then he's okay to do a chop. So we're saying give him a front foot elevated chop on the left. And then at some point we want to throw in like the left leg back and start going after, not at some point we're gonna, if we do the left foot forward elevated and we do a bunch of chops there, at some point we're gonna have femoral internal rotation, and then we can go after the expansion between the ischium and the sacrum. So then in that scenario, the next little step we can take would be heels elevated, left foot back, and then we can get rid of the heels elevation. Is that kind of like a process that you can follow for the chop or no?
If you just did a chop,
Yeah.
And like really where you want to go at the final progression for me for the chop would be the cables beside him on the right side, left heel or left foot back, and you're kind of turning into the left side. It's like hoisting the thing, the sword. Do you know what I mean? Like you're coming across like that. Because if you can get that rotation coming across your body like that, then you have that really sharp turn happening.
Well, yeah, I think we've talked about a long time, maybe 2-3 months ago, that we want for our Nero to go after femoral IR
Yes, first.
on the chop kind of thing, right?
Yes.
And then you were saying that from the side might make more sense because it's like more of a momentum from that side or whatever.
Yeah. It throws the
Uh,
side forward more into hip extension.
What's that?
It like if I go sideways beside me, I'm going more frontal plane, right? Does that make sense?
Yeah.
So I'm sticking myself into IR. Okay.
If this still bothers him, would just like separating the feet wider would that also be an option,
Yes.
right?
Yeah.
Because I was trying to like make a little note about what we've been talking about and like just throwing a bunch of exercises, and I was like, because I feel like we've talked about a split squats, we've talked about I guess chops, that type of stuff,
Yes. Yeah.
and like sometimes we place them like split squats first, chops second, and then sometimes we flip them around
Yeah.
in
Yeah.
terms of. So I was like saying, I was thinking like, okay, like what kind of like principles do you follow in your kind of mind? Like with this person, I'm thinking split squats will be something I can try first, then a chop, and then with this person, I'll try maybe a chop before I try split squats. Because I know sometimes like I feel like we've talked about with Greg a long time ago, like it was like if it's narrow, then likelihood that they won't have nutation, it's like a little bit greater. Therefore, don't go into nutations exercises too fast. So like he had that kind of mentality from what I gathered. So do you have like a principle that you follow? Like you're like, okay, like this looks like will be more of a up and down kind of person, and this will be more like a hingy type of thing that I would do with this person.
And for
Could
me,
this guy do could this guy do like a sumo like kettlebell deadlift or something like that too? Would that help him since like you talked about how it's wider and more ER that he needs to be? Or is that too compressive, or you're gonna stay away from bilateral stuff?
I
It's just
I
off
gave
the
him
top.
I gave him a box squat with a TRX with heels elevation, and he's okay with it. Doesn't bother him.
I think the sumo might be too wide because what it's going to do is it's going to lock. I mean, you could try it. What you're trying to do here is you're trying to turn the pelvis to the left, whereas the sumo is going to lock him into IR.
No, okay.
He'll have no rotation, but what's going to happen, unfortunately, is like if you lock him into IR and he's got a pelvis that's turning towards the right, then it's going to just like maybe tip him more forward, and that could
He's
cause
gonna
compression
orient.
right there.
And
Yeah.
he's probably gonna go too far into that right side. Okay, that
Yeah.
makes sense. Yeah.
If he didn't have it, and I'm like, hey, he's got decent straight leg, maybe like 60 straight leg raise on the right, 50 on the left, and 100%, right? Like I'm locked in the IR. I have minimal rotation there. I can lock him into place. But Ivan, answer your question. You got to think of like the way that I think of it is that a split squat is force that's generated from my feet. Okay. Whereas a chop is a bottom up, whereas a chop is more top down. Okay. So you've got somebody who has flat feet, or you have somebody who's very stiff. You can't expect them to generate the force in the foot, right? Because if they've got all that tension, where is the wave like effect going to go? Like, where's that ripple effect going to go? If I'm using my foot, it may stop at my calf, may stop at my knee, femur. It's not going to go up to the hip. Does that make sense? Right? So I had to do something more top down where I'm placing my foot in the position I want it to be in, right? And then I'm using something like a chop or something top down to kind of, alleviate some of that tension. So somebody who is stiffer is going to benefit more from using something like a chop or something like that where you're unweighting the foot. Where somebody who you've gained a little bit more mobility, you can start using the feet. Right? Okay. So for me, it's like if I've got very limited hip extension or very limited straight leg raise, a split squat, a normal split squat is not going to be a good option. Right? A lateral lunge could be a good option because again, you have your legs a little bit wider and therefore you're unweighting their body a little bit. But maybe a lateral lunge chop would be effective, but the chop that we just described, it probably wouldn't be on the table. Because it's like you need to get a certain amount of hip extension through the back leg just to get into that setup. Whenever I'm doing staggered stance, I'm thinking I'm getting a sacral influence, sacral movement, okay? Depending on the direction that I'm chopping. Right? But in order for a narrow to get the sacral influence, they need the femur to IR. A wide doesn't have that problem. They're okay with femur stuff. So I could start them with a split squat a little bit earlier on, right? Because they have femoral IR, or I can do a stagger stance chop a little bit earlier on because they have the femur IR. Their problem is they can't yield the sacrum. Does that make sense a little bit?
I was gonna
Because
say,
they're mutated.
are the narrows going to be the ones that have a lot of SI joint issues where the wides are going to be more prone to like say hip issues? Because going back, like you said, where are they yielding?
Yes. Yes.
Not that really kind of means much, but it kind of gives you an idea of like, okay, like
Yeah.
generalization. Yeah.
The wides are going to be like, oh, it generally, like if this is my lower back, if like I feel tension along here.
Yeah.
Where
Where they're
there's
going to be more like your
back
labral
around-
issues or your hip impingement stuff versus the narrows are going to be more SI, and
knee,
we're talking about the shoulder, probably more like medial scap issues and stuff like that.
yeah, medial elbow, knee stuff, right? Like that's gonna be. But am I thinking, oh, this person can't nutate, so I'm not going to create exercises that are going to nutate them? Well, just like we said, with a narrow, we want to go femur and then sacrum. With a wide, we want to go sacrum, then femur, right? Femur, then sacrum, because I need to be able to turn into that hip to be able to influence the sacrum. I can already turn into the hip for a wide, so I got to do the sacrum. Does that make sense? So it's like I am doing stuff for a wide to make sure it has the ability to counter nutate. For a narrow, I'm making sure I have the ability to IR my femur, and then I'll worry about my nutation after.
Big review really quick. This was a while ago. We went over this when we first started talking about femur up through innominate or innominate down through femur. So the top down, we said, is going to influence, like we said with the chop, right? Femur, femur, and then innominate, then sacrum, versus bottom up is going to influence sacrum, femur, innominate in that, sacrum, innominate, femur in that order.
Sacrum, innominate, we do bottom up.
Did I get that right, or did I get that backwards?
Yes. Nope.
It was a while ago we went over that. This was like months ago. We initially started talking about bottom up versus top down. You remember?
If I go bottom up, then I'm gonna have
through the foot. Yeah. So if we're talking about that flat foot before.
Yeah, it's gonna shoot my center of gravity backwards more.
Mm-hmm.
If I go top down, I'm driving. Like for example, if I do a right arm press, I'm going to get more right hip extension.
Mm-hmm.
Okay. So it's actually going to influence the sacrum's ability to nutate.
Mm-hmm.
Top down is actually sacrum top down is gonna be sacrum, sit bone, femur, whereas bottom up is gonna be femur, sit bone, sacrum. 'Cause if you
Oh,
think
okay,
about-
sorry.
It's like distal to proximal, right? It's like if I
Yeah,
some in my hand, I'm doing a push-up, the force is gonna go distal to proximal.
but
Right.
the chop you said is gonna. Oh,
It's gonna be the
What if you
sacrum.
do a step down, a step up? Would that make it easier to think about it?
If I do a step
What would
up,
open?
what would open if I do a step up first?
If I do a step up, what would open first?
step up is bottom up, right?
Mhm.
So would it be femoral IR first?
Femur up through sacrum.
And then we said that step up and a chop, they're the same
Yes,
or similar. So would that connect then? Is that connected?
yep. And a step
Or-
down is center of gravity moving forward, so therefore it'd be hip extension. Because I have to decelerate my body weight, which therefore means I'm going proximal to distal. I'm slowing myself down. It's gotta go proximal to distal, speeding myself up. Distal to proximal,
So the chop is bottom up or top down?
bottom up.
Okay, the chop.
Sorry,
is
sorry,
bottom-
sorry.
Okay,
The chop,
chop is top
the
down.
chop is gonna be top down. Top down.
So that's gonna go.
Sacrum, sit bone, femur.
Okay.
The
Okay, got
problem
it.
with the narrow is that they can't get the femur. Okay,
Mhm.
you need the femur to open up first to be able to unlock the sit bone. Okay. I need the posterior capsule to open up.
Even yeah, but I'm just thinking of like trying to think of it like the wave. Yeah, like the wave from the force, like top down, because they already have that
Okay.
space, right?
Okay, so think of it this.
Why? I guess why wouldn't that drive? Why wouldn't that open up
So-
femoral IR if their limiting factor is the femoral, not the
Yeah.
sit bone space?
So think about it this way, Ryan. If I do a chop from right to left,
Mhm.
my right side is going to be a top down. My left foot is going to be a bottom up.
With the left foot forward, like I said
Yeah,
before.
left foot
Okay,
forward.
all right, that makes sense. Got it.
Okay.
Okay.
I'm pulling
Oh, so
down
it's
here.
revert. Oh, okay. So it's revert. You got to think of both sides.
Yeah,
Got it.
it's like
Okay.
my left foot is now
Yeah.
stomping into the ground to push back, right? Otherwise, I just kind of collapse over.
Mhm.
Does that make sense,
That
Ivan?
makes. Yeah.
Think of it like this. Like, look, if I do a chop, okay? If I do a chop.
Mm.
Okay, let's
The
say
opposite
cable-
motion has to happen on the other side. Yeah.
Let's say the
Yeah.
cable is beside me here, okay? And I do this. Okay, it makes sense that because I'm pulling with this right side, it's top down. Does that make
Mhm.
sense? But in order for me to turn into the side, what has to happen to the left side? When I go like this, all the force is now going down to my left foot. So my left foot has to push back up. Otherwise, I'm going like that.
Mm.
Make sense?
So then,
Something do this, you'll feel your left foot get heavier.
in that scenario, you're saying bottom up on the left.
Bottom up on the left. So
Mhm.
we're on the left. Hip extension on the right.
And if you stay there and you throw a lift,
If I do a lift. Same thing, I'm just overemphasizing this right side. Okay, what I'm doing with the lift is I'm starting my right foot into early IR. Ending it in late. Okay? So let's say you have somebody who. You're like, okay, what I want to do is I want to bring them back on the right side. All right, I got them on the right side, I got some femur internal rotation. I want to start to turn them over to the left. Now what I'm gonna do is I'm gonna do a staggered stance. Cable lift to the right side. So now I'm taking this left side that's in late IR back into early. By extending this right hip. Does that make sense?
Mm. But you need hip extension first on that right leg, otherwise you're just gonna orient.
Yes, yes, so this would be the sequence, I go. Cable chop to the right. Sorry, cable chop to the right.
Front foot forward, yeah,
Front foot
right
forward.
foot.
Cable
Right foot forward.
lift. Right to left, right foot back.
Mhm.
Then left foot forward. Cable chop straight on. Cause I wanna go back into this left side. Okay? This makes sense so far?
Mhm.
When I bring somebody back on the right side, why did I do a sideways, bring somebody back on the right side?
Femoral.
Yes,
Yeah, you gotta give them space on that right side first to be able to, for the right side to push to the
Yeah.
left.
now,
Yeah.
why would I do this now? And come straight on? Versus sideways?
Tell the left side back, yeah.
Because what I wanna do is I wanna hold the sacrum in place, get the femur going. Whereas in this case here, we've got a right oblique, the sacrum's already going that way. I don't need the sacrum to go back anymore, I just need the femur to internally rotate. So I can IR the femur, then I can extend the hip. See what I'm saying?
Hmm.
This left side is already in this perpetual hip extension. Every time I take a step, it's trying to turn me to the right. So what I want to do is I want to go back onto this right side. Okay. So I go like this, boom, back on the right, then cable chop. Then, sorry, cable lift. Then cable chop. Right?
In that scenario, could if you stay in that position where your left foot is forward, if you elevate the left foot, would you care about which direction that a band is coming from at that point? Because
If you are,
You could probably chop to the back pocket there because that's earlier, right?
yeah, okay, are you wide or narrow?
let's go narrow.
Okay, then probably face on, right? Because face on is gonna drive this mutation action.
But why do you want to go to the side? Is that what you're telling me?
Yep,
Because it's gonna drive more femoral in that scenario.
Yep.
I don't know if this helps anybody else, but going back just basically when you're talking about like the femoral movement first, should we just think of it just the same way the shoulder, whereas like the first 30, 45 is like just humeral movement, right?
Yes.
Same thing, yeah.
Yep.
The only thing with that is like, depending if we start with a hinge or not, because I feel like back in September we were talking about like, you know how David Gray starts his thing with hinges,
Yeah.
Mhm.
and then you like you I guess in that scenario, why you
It
pick up the
locks you in
slack.
place. It locks you in place. That's the whole intention of it. It's like I am going to bust open that posterior capsule of the hip. I'm getting femoral IR on that.
Mhm.
Because what I'm doing is I'm hinging my hips, therefore nutating the sacrum. And now the only option is my femur to internally rotate. Otherwise, I'm going to fall over.
So when he does this thing where it's like
The hip
where it's like
hinge
kind of like if you let's focus on the right leg or
Mhm.
right butt,
Mhm.
like the right butt and the right leg is forward, and he's doing this like trying
Yeah.
to open up the back pocket. He's kind of like the back pocket is like the sacromiscial space. Is that so? I mean, that's
Basically, Eric
technically
Kopp.
open.
Yeah,
It's
That's
just
it's literally
technically
Eric
open
Kopp.
already.
He's just doing it as a hinge.
he's doing it.
Yeah.
He's doing it as if the sacrum's already open. It
Yeah.
shouldn't be
So when
anyway.
he's cueing, you gotta feel the pocket elongating and all that. Technically, we're looking at more of behind the femur kind of like area
Yes.
trying to open up.
Yeah, you're talking about piriformis, gemellis, those muscles elongating.
Because it's like a staggered stand deadlift,
Yeah, because you're looking at
but
this.
the
This
Usually when I'm thinking stagger stance deadlift, I'm always thinking the space that we're opening is the leg behind, the back leg.
But
Whereas
he does-
he's kind of like aiming the right side. The
I know, but
front leg.
he does all these things in kickstand, right?
Yeah.
Like he doesn't do like as soon as you put the back heel on the ground, you change the game. But if you got your toes on, you're locking yourself into mid stance here, and then you're folding over slowly, you're getting this femur turning inwards. Right? So if you were doing this, Ivan, you were doing this. This is very different than if you were doing that.
The Campo ones needs more relative motion.
This is relative.
That's, yeah, that's a more advanced one than the kickstand.
Yeah, this is
That's-
sacrum. This is sacrum.
Yeah.
This is femur.
Femur.
That's why that guy from week 7 was saying that he did it and then he got injured.
Yeah.
Your during your evolve, wasn't it? And then you were
Yeah.
like, you might have you should do a kickstand before you go for a flat
Yeah.
foot, right?
Mhm.
And he did it, and you know what? The kickstand cleared up his back,
Nice.
right? And it's because there was too much. Again, the same thing with your guy. It's like, in order to do this kickstand, he was doing this. Like you watch my left knee. That's what's happening. Everything's kind of rotating like that. He's not able to have this IR, the femur, to be able to turn back into that back pocket. Right?
So when I was
So-
asking him,
Would you want to see
Go ahead,
Ivan's
Ryan.
guy do a lunge too? I mean, obviously you could do a step up, right? That's probably going to be his first thing before a lunge, but
What kind of
before
lunge
he
would you
does
do?
any kind of split squat, you'd want to do a reverse lunge, right? Like a front, well, I
TRX supported front foot elevated is probably what I would do.
front foot elevated.
So
Yeah.
yes, you're right. It's basically like a reverse lunge,
Mhm.
simply speaking, right? But it's like his left foot's on the box. He's holding on to a TRX that's unweighting him because he doesn't have he may not have the ability to do this yet. But holding him here is going to make his body, his lower body lighter. And so he's able to relax the tissues. I see it as like a tractioning. If I hold a TRX or a band that's kind of coming from a pull down bar or something like that, right? But if it's
you
in
know what's the
front-
sad part? He just rescheduled.
Oh,
he was right. He was just right at 3 o'clock. He just rescheduled.
oh my God. You guys
That's
allow that
okay.
to happen?
We say, we say like, hey, we have a cancellation policy, but like if it depends which part of the neighborhood you are. In Scarborough, it's kind of wild.
That's it.
In Etobicoke where I work, it's not that bad.
Are you in Brampton now? Is that why?
No, I'm in Scarborough right now.
You're in Scarborough.
Fridays is my Brampton gig.
Of course, Scarborough.
Brampton is a wild place too, dude.
Dude, Brampton's insane. I
Hey,
crossed
if
over.
you come in Brampton, I promise I won't be like Travis and I'll talk to you.
Yeah. Man, when you cross the 427, it's a different game out there, man. The way they drive and
Oh yeah.
they don't give a shit. They don't. I went to so you know what I do is I collect, no, I don't collect coins, but you have like a bill and then you pay and they give you change back. A lot of people just kind of throw the change away. I actually put it in a jar and I save it, and it's, you know what it is? It's like a Toronto Maple Leaf. It looks like a Toronto Maple Leaf beer bottle, but it's this big, right? It's like a 5-liter bottle, and I'll fill it up, and like I just deposited it, and it was like $1,200, right? From like 5 years of collecting coins, right? Anyway,
That Santorini trip got paid off.
Santorini trip, the flight's gone. But we go to the Sobeys over in Brampton, and I'm walking in with this big jar, like pretty happy. And then all I see is like I'm walking in, and do you know how they have like the turnstile or like the door that kind of opens like this? And you can't push it open if you're already inside. Well, I push the grocery store open. This guy has yogurt and a piece of bread, And he just runs out. And I was like, what the hell just happened? Sasha's like, he stole shit. I'm like, maybe we shouldn't be depositing this cash here, right? But it's a Coinstar. It's something called Coinstar. You can only deposit it there. Anyway, yeah, Brampton's interesting, but they got great. I love the samosas there. Do you have a good samosa place?
No, I don't.
Oh
I
man, there's a
don't.
place at
Dude, I don't even know if I can't even get into an Indian restaurant because I just get confused. I have no idea what to order. I'm like,
same.
I'll just stay away.
Brampton is like the Indian area of Toronto. And Scarborough is kind of a little bit too.
Yeah.
Yeah. Yeah. All right, guys. I gotta run, but I hope this clarified a little bit, Ivan. A little
Yeah,
bit.
it was good. It was I gotta listen to it again, like the split squat going backwards in the cycle, in the gate cycle, that I gotta clean it up in my head. Hopefully, like I'll listen to it again, and if anything, we'll talk about it next time.
Here's something that we never discussed, and it probably makes more sense, but it is kind of confusing at the same time. There is a point where your leg is in a swing phase. When I'm
Right.
doing a front foot elevated, my back leg, technically speaking, is in late IR, and my front leg is in swing phase. Right. And then as I go down, I then move into because now I got force in the ground, it kind of switches back into the gate cycle rather than go into early IR. But again, I find it confusing. I don't really think in terms of swing phase, but technically speaking, that's what it would be. And if you think about like a step up, the top part of a step up, when I march my knee up, technically speaking, the top leg is a swing phase.
Well, makes sense. It's ER.
It's
Yeah.
ER, but at the
Yeah.
top of swing phase, when you fully maximize hip flexion, or you're at the top of hip flexion, as you have to go back down, it is technically IR at the top. Okay, because your hip, I think it goes to like during gait, I think it's like 40 degrees of hip flexion. But technically speaking, that is where IR begins to be able to push your foot down to the ground. Like imagine if I just marked my knee up and nothing resisted it, it would just keep on floating away like a balloon. So I need something to reverse gears and push it back down. And so at that peak point, that's IR. So technically speaking, top of the step up, you got hip extension on the right, you've got early IR on the left because it's floating in the air, but there is an IR component to it.
That's why it's almost good. I've been playing around with because so many people cheat doing step ups. If you just leave the front foot on the box, they'll try to jump off the back leg.
Yeah.
So I'll tell my kids to lift the front foot up off a little bit and then push down through it to try to drive the front foot. Yeah.
What I do is I get them to lean over, like lean forward and push the knee towards the toes, but don't lose the heel. And when you do that, they're on their toes. They can't push off the back leg. And then it's just driving through. And it's just like maximal femur IR. And then you get into hip extension easier, keeping it nutated. But anyway, I wouldn't worry too much about swing phase. Just remember, as I go down, I yield. As I come up, I propel. And so if I'm propelling, it depends on your starting position. If I'm in a normal split squat, I'm going straight up. If I'm in a front foot elevated, I'm going forward. If I'm in a rear foot elevated, I'm going forward. Right?
You're going forward on rear foot and front foot?
Yes. But rear foot, I'm already starting forward and I'm going more forward.
Oh, okay.
Okay. So I'm starting in like mid stance and then I'm going to late. Whereas, or you can say you're starting in, yeah, I would say mid stance going to late. You're not going to toe off really. And then if you're front foot elevated, you're going back down into a decline. So you're going back into early, ending in mid. Right.
I would say it's Ivan, if you have like a small hill by you, like I said, like I go over and do my sprints over like on this at this park where there's like this little like walk up ramp, and I just mess around with some of the stuff there, and it just makes it easier just to kind of visualize, I guess.
Yeah.
I just bought those
Yeah.
ramps that you were telling me about, Alex.
Yeah.
I've been using them in the gym a little bit. I've been doing I was like, let me try a curtsy step down. And I was like, oh, this is impossible. Like, why am I giving this to patients? It's so hard. Like, so I started doing like step down to the side, like, or
Yeah.
like a reverse lunge kind of step down.
Yeah.
But like, I'm like, there's a long way for me to like actually do a good curtsy squat and not screw it up.
You do the heels elevation curtsy squat, it'll be easy.
I did.
Should be easy. Should be. But
And
like
I'm holding something too.
I mean, check out this picture here, right? You've seen this picture before.
Yeah.
This is what we're talking about here. Okay. This is the start of, sorry. This is the end of the front foot elevated split squat. Okay. I go from here, right, to here, to there.
Is front foot or front leg or back leg?
The front leg as I come up is going to go like, but on the way down, think of the arrows as reversed.
The front leg.
Yes. The back leg's going to be the same thing, right? It's just starting later. It's like the back leg is starting here, moves to there, and then goes back, right?
But it doesn't go back, it goes further forward.
It goes further forward, yeah. Sorry, it goes, yeah. It'd be like if there's another one right there, and at the end, you'd be like, you're here and you're going to there.
This is more of it's emphasizing center of mass moving more as opposed to kind of center of mass fixed in a split squat and everything else is just balancing around it, moving around it. Yeah.
Exactly.
Should I be thinking about like more like I'm just milking that area? You know what I mean? Like I'm just getting this person to be good at whatever.
Just oscillate then.
Early IR to like going a little bit backwards and then come a little bit back to IR, maybe a little bit further, go back and forth until they're comfortable doing it or there's enough space there. Yep. And then take another space of the gait cycle, which is like a little bit further out and just milk that, which is probably like, I don't know, would a lift be something to do there in that scenario?
100%.
A lift would a lift be, if you were like to find like a person that's stiff, would a lift look like right foot forward lift and then right foot back lift?
Yes.
Right?
Yes.
And then you can do all this other like intermediate stuff where it's like elevation of the heel and that type of stuff.
Yeah. And if you want to keep it so they're not pushing too far to the other side because they're stiff, right? They can't really rotate. Then what you do is you milk it, but you stay down. So you're here and you go like, you're not coming up like this.
Yeah. And this is in this position, you're just going early to early to like late kind of thing.
Yeah, the cable's pulling me into early, and then I'm going into late, but I'm not going fully into late. Do you know what I mean? Like I'm not actually turning the pelvis yet. I'm kind of just doing, right? It's like oscillating. Like I feel hamstrings and glute right now. When I go here, I feel just glute, no hamstring, maybe a little bit of calf, right? So you just oscillate it. You're like, hey, I'm going to lock you there and I'm going to drill you into the ground so that those things open up. Right?
Cool. Yeah, makes sense. Makes sense.
Use the cables, like, hey, let the cable pull you and then push against it.
I got a cable right here and I have a 30 minutes free, so
do what I just did, like the oscillating, and then do the full one and feel how these things, like, feel the different positions. That's how like you figure it out. How it
real quick, where would you throw in the kickstand hinge from David's Gray stuff within like this like, obviously it's not ground stuff, like where are you throwing it? Are you throwing it like within split squats, like where are you throwing it in the front?
Stiffer people.
You do it for stiffer people?
Stiffer people.
But you definitely, in my opinion, you're definitely throwing a lateral lunge earlier than whatever David is
Lateral
doing.
lunges earlier. Once it's, you know what it's like?
But that was kind of the question that I was
This is
weighing
kind
with
of
you.
like a transition between lateral lunge to split squat is that kickstand deadlift. Like I
Ah.
see that as like a transitional period because
That's what I thought a chop would be, you know?
it is as well. It is as well.
Yeah. That's why I was kind of asking you that question earlier, like where do you like what principles you use between a chop and a split squat? But I probably wanted to say what principle you use between that kickstand hinge and a split squat.
It would be probably be kickstand and chop and step up would probably be like good options before you go into a split squat with somebody who's stiff,
I'm
right?
guessing even reverse lunge, right?
Even reverse lunge is effective. Yeah. Awesome. All right, guys. Great call. Ivan, let me know how it goes when you play around with this stuff. And
Will do.
got Evolve tomorrow and then see you guys in a couple weeks.
Awesome. Thank you,
All
Alex.
right.
Take
See you,
care,
everybody.
bye-bye.
Take care.
Bye.